Welcome back to the Health Revival Show. Today we have Dr. Michelle Perro with us. We met her at a conference recently called Reversing Autoimmune Disease, and she gave a beautiful presentation. I, of course, had to go connect with her and introduce myself to her because she is a wealth of knowledge, but she most importantly has a heart of gold and a passion for our children and empowering families and especially moms to understand how we can do better for our children. As you all know, listening to this show, we strongly believe in functional medicine and standing up for what you believe in and putting things in your children's bodies that is going to be nourishing and supportive of them. So we're just so honored to have her here. She has 40 years of experience in pediatrics and integrative medicine. Again, she's just a wealth of knowledge. So welcome to the show, and thank you so much for being here.
My pleasure, Liz. Thank you for rounding me up at that conference and inviting me to talk to your listeners. I'm always happy to share my views. I'm not shy.
I
Yes.
love it. You're at the perfect podcast for that. So would love to hear, in pediatrics, how you kind of paved this way for yourself of what I would say is maybe for some a controversial point of view, for us a real point of view, and challenge kind of the mainstream of what a lot of pediatrics push and dare I say gaslight around. How did you kind of end up in this frame of thinking and voice that you have developed?
Certainly, and I'll try to make it brief because I've been at it for a while, but I'd have to say serendipity is my friend. And I am a pediatric emergency physician by training. So, integrative health, holistic health, homeopathy, natural solutions to health were not really in my wheelhouse. I'm from New York, which this is the state of troglodytes. I think it's archaic. I'm sorry, New Yorkers, let me call it as I see it. And so what happened was when my own son, 31 years ago, had a medical issue, I had an encounter with an MD homeopath, and we crossed paths at the same time. And she told me to give a remedy, a homeopathic remedy to my son for this condition. And I never heard of homeopathy. I didn't know why they had Latin names. I was thoroughly confused. I couldn't believe I gave my son these little sugar pills that at that time cost $5, and lo and behold, 5 minutes later, he was better. It happened again. I did it again. And so you would think that I was overjoyed to find this solution to health challenges in kids. Now, I did have a private practice. I was at Oakland Children's Hospital at the time. And instead, I became enraged. I was never comfortable with the Western system. My personality has always challenged the status quo. I never liked in medical school how patients were cared for. I didn't like the old boys network work that I was surrounded by. I always felt like I was on a fight either for people of color, income, women, children. It seemed like that was my nature. I rise up against injustice by design. So I went home and said, heck with this. Went home. I had two small kids now. I went to school at night online to study homeopathy. I got my degree online of a school in London and New York. It just so happens, which is no longer, they closed during COVID. I got my degree. And eventually I needed to pivot out a mainstream, but because I could no longer tolerate it. And I did have a big blow at Children's Hospital over a racial justice issue, and I left. So you can see I'm a bit of a warrior by nature, but not in the food movement. It was a bunch of moms from my practice who I joined the homeopath who originally, told me what to do with my son. They are the ones who said, Michelle, have you read Jeffrey Smith's book, Seeds of Deception? And I was like, what? I, I had a integrative practice going on. I was doing homeopathy with urgent care. I opened my own business, kids, soccer mom, PTA mom. Oh dear, I was so busy. And I said, no, I have not read this book. And they said, read the book. So I have the luxury of having a skill that when moms talk, I listen.
All right, if you're dealing with water retention, you're waking up puffy, your ankles or your wrists are really swollen, or you can't get your rings off, and maybe you're even dragging throughout the day, no matter how much water you drink, there's actually a good chance that you're not actually hydrating properly.
Exactly, because water alone is not enough. You need electrolytes, you need sodium, potassium, magnesium, because those things actually pull water into your cells. Otherwise, you're basically just flushing it out and wondering why you're still tired, you're still bloated, and you're still sluggish.
But here's the thing, most electrolyte supplements out there aren't helping you in any way because a lot of them contain things like natural flavors, food dyes, and maltodextrin, which can irritate your gut. And these things can also spike your blood sugar when you're trying to heal.
That's why we both started using Buoy. It's super simple, just trace minerals and electrolytes in liquid form. No flavors, no colors, no sugar, no sweeteners, and you squeeze it into whatever you are drinking: water, coffee, tea, smoothies, you name it.
And it's clinically backed by science too. So studies have shown that buoy helps you hydrate better, 64% better, in fact. And that's data coming from key blood and urinary markers, not just marketing fluff. And honestly, you can feel the difference. I've had many clients tell me their digestion's improved, they have less headaches, and they're better energy throughout the day.
And Buoy isn't just for people that go to the gym all the time and sweat a bunch. They actually offer a 35% lifetime discount for anyone that's struggling with chronic illnesses. Things like POTS, Hashimoto's, Crohn's disease, chronic migraines, and every autoimmune condition. They're really committed to making better hydration accessible to people who need it most.
I actually throw it in my coffee every morning because it's such an easy upgrade. You don't even taste it, but you're definitely going to notice if you miss it.
If you're tired of playing hydration roulette and want something that actually supports your body, you've got to try Buoy. It's honestly one of the simplest ways to feel better faster.
This mom spoke. I listened. I read the book, and my literal life turned around when I read about the effects of GMOs, not pesticides, by Dr. Arpad Pusti. Bless you, Dr. Pusti, rest in peace. And I said, oh my God, because it was around 2000, which is 25 years ago, that I started seeing an uptick in chronic gut disorders as well as autism spectrum in children. And I was going around to my colleagues here where I live in Northern California saying, hey, are you guys seeing this? Like, what the heck's going on? And I was seeing these kids for ear infections, stubbed toes, lacerations, sprained ankles. And oh, by the way, he lost milestones. Oh, and by the way, this is eighth ear infection. And oh, by the way, he just developed acute onset of asthma after the flu vaccine. And I thought, oh, whoa, whoa, whoa. And I did another pivot saying, I am not serving anyone. I need to train myself in environmental medicine, which is what I did. And I've been training myself ever since. I am a student of education. I know a lot. There's so much more I need to know. And went on this course from then, and I've never looked back.
It's amazing. And it's also angering what you learn as you continue to educate yourself, right?
I have a kind of a fury personality. I'm passionate for what I do. I like to think of children's health as a calling, not a career. I love children, animals, and plants. Adults are okay. You people take care of the adults. And I feel that my calling as life is to nurture the vulnerable. I don't let plants die. I have chickens. They eat better than most people I know. My chickens are like bougie chickens. I have a bougie. My old children's play structure has become their chicken coop. Oh, yeah. So they're living in a duplex chicken coop
Awesome.
with yard time every day and I give them fresh fruits and veggies every day, probiotics. Oh yeah, I'm that mom. So I try to walk the walk, talk the talk, and be a student every day.
I love that. I love that. You mentioned that you got into this about 25 years ago. I would love to know, we've seen many chronic conditions just skyrocket. So you mentioned GMOs. What else do you believe is just fueling this explosion of illness in our children?
I think it's multifactorial. It's not just one thing. I think GMOs and pesticides, glyphosate based herbicides, Roundup, are drenching our crops for sure, driving it because they cause immediate dysbiosis, which is abnormal microbiome. And we can get into that. When your microbiome is abnormal, your neurotransmitters, the chemicals that you run your brain are normal. That's one. So that's huge. It's the poisoning of our food supply. So I've been on that for a long time. Secondly, it's toxic metals. And as you guys know, I recently published last year, I looked at 40 infant formulas for toxic metals, and it was horrific. And then in December, we published a study looking at Girl Scout cookies, 25 cookies for toxic metals and glyphosate, Roundup, horrific. So I'm all over the toxic metals. In addition to the toxic metals, they work synergistically, negatively synergistic with the pesticides. So when you have multiple toxic substances, they can work in unison. Like glyphosate and aluminum work hand in hand, and glyphosate can shuttle aluminum across the blood-brain barrier 6 different ways. So I also know that the toxic metals also come from geoengineering. Florida just banned geoengineering, and I am not an expert, but I am definitely a spray aware kind of practitioner that we have to stop the spraying of our skies. I think 35 states have legislation pending to end geoengineering. So that's a big topic. So in addition to that, we've done something else. I'm just giving you the top 3 because parents are going to go, "Oh my God, Dr. Doom and Gloom is on the mic." Are EMFs, electromagnetic frequencies. So what COVID did was drive our kids to laptops. You've seen these keyboards. Every kid has an iPad in school now. You know, Here in California, they had the brilliance of putting up a 5G tower in an elementary school in Ripon, California. Within 3 years' time, I think there were 6 people, teachers and students, who came down. I believe it was leukemia, but I'm not sure what kind of cancer, but cancers. And it was the parents, not even the school, that got that 5G tower down. So electromagnetic frequencies are not benign. And then I would be remiss, and I can say this on your podcast, it would be vaccinations. Vaccinations per se are not bad in principle, as a theory of you give a small amount to stimulate the immune system. But what they've done to them is so horrific that I can't recommend not even one because of the adjuvants, which are different ingredients that are added to the vaccines to stimulate your immune system more. And what they use now is aluminum. They're now using nano aluminum, very small, crosses the blood brain barrier, folks, 10 to the minus ninth. They've used thimerosal in the past, as if, mercury's bad. Aluminum's not good either, folks. And the other things like formaldehyde and preservatives and antibiotics and aborted fetal cells. And this is like a cocktail for disaster. And then lastly, I must add in, although I feel like I'm on like a soapbox, but is all things COVID.
Yeah.
The pandemic, the GMO COVID virus, the unnecessary COVID jabs, inoculations, vaccines, call them what you will, and all the secret sauce that went into producing that little cocktail that they are insistent that our children get. I just put today on the federal government's commentary to take off COVID vaccinations. I put in quotations because they're not vaccines, they're immunomodulating genetic therapies off our children's schedule, pregnant women, as well as mRNA technology. I just posted that. So we need to remove it yesterday, this mRNA technology from our children's lives because it's causing genetic issues, not to mention immunologic and et cetera. So I think those are the major factors: harm from lockdowns, harm from wearing masks. Our children really had a pause or a setback during that time. It wasn't good for any of our children, except because of lockdowns, people didn't go to the pediatrician's office. They did not go for their well baby checks. Vaccine rates went way down, and the rate of SIDS, sudden infant death syndrome, plummeted. Interesting observation, huh?
Mm. And it's devastating. And oh God, any loss of a child or, horrible injury to a child from these medical situations. And it's such a hard subject too, obviously, because you don't want to create any type of shame or guilt for parents. And it's such a hard topic to discuss, but it needs to be discussed because what we don't know. Right. And I'm actually grateful in some ways for the COVID period because I think it woke a lot of people up to what was going on and what is still going on. And it's terrifying at the same rate because of the turbo cancers that we're seeing and all of these things that are happening, especially for doctors in particular that got multiple rounds of these COVID vaccinations that are very like cancers that don't respond to cancer treatment because of the nature of them from what people have been exposed to. But back to children. So I would love for you to kind of touch on the gut microbiome and how from birth, how this is changing for many children compared to
Mhm.
20, 30 years ago, and what it's doing for allergies and chronic illness and all of these responses that we're having to, vaccinations or getting reoccurring illnesses like strep or other types of, higher rates of autoimmunity that we're seeing so young in children. Can you talk a little bit around the gut microbiome from birth and how that's affected with what we're now
Yes.
exposed to, all of the lists of things?
Yes, 100%. So moms are the stewards of baby's immunologic well-being, and the way that happens is through the baby acquires the microbes, the bugs that mom possesses as the baby is born through a vaginal birth. In a C-section birth, which is about one third of U.S. births, they don't acquire it, so you can pick it up via breastfeeding. So mom, it behooves mom to do the best diet, the most fermented foods, the best probiotics that they can afford to ensure that they have, a really vigorous microbiome. So baby inherits that. So babies are not born sterile even before they pass through the vaginal canal. We now believe there's a placental microbiome, a fetal microbiome, and there's data that now supports that. So babies do have some colonization with microbes, but nothing like when they're born and they inherit moms. So what those microbes do, and they're a collection of bacteria, viruses, fungi, protozoa, archaea, 5 different groups. What those microbes do is talk to the baby's thymus. The thymus is an immune gland that sits right behind the sternum, nice and super big in babies, minuscule, looks like a small nut in adults. It regresses over time. That thymus is responsible for producing a wing of the baby's immune system called the innate immune system. You have two arms, the innate, adaptive. The innate is your front line. That is why babies do so well against COVID, because you need a robust innate immune system to battle viruses. The adaptive one is the one that sees an organism and then has to process it after getting information from the innate system to produce something called antibodies. It's a more of a delayed system. Then these microbes then produce various substances to protect baby. The main microbe that babies need is called Bifidobacteria infantis. Those bifidos produce something called short chain fatty acids. Those chemicals change the pH of the baby and the poop to make it less hospitable for pathogens to grow. Additionally, those short chain fatty acids can cross the blood brain barrier and modulate brain function. They have a role, and there are 3 of them, with butyrate being the most significant, but they're all important. 100 years ago, when you looked at fecal smears, they were literally a monoculture of bifidobacteria. But through time, babies have less and less bifidobacteria. Babies now who are formula fed and a C-section baby have a microbiome that looks just like an adult. And you are supposed to transition over the first 3 years of life, 858 days is what I've read, from this bifidobacteria enriched microbes to a more diverse with lactobacilli and a whole bunch of other microbes. These microbes, in addition to changing the pH, produce various vitamins like B12, which is one of the key ones for helping you detoxify. And additionally to that, it produces something called, which I mentioned very briefly, those neurotransmitters. They make the chemicals that calm you, that excite you, like serotonin, GABA, epinephrine, norepinephrine. And those chemicals, I call them metabolic response modifiers, go outside up the vagus nerve, which is your main connector from your gut to the brain. Up, it goes up into the brain and then tells the brain what to do, you know? And so if the baby has from a diet that mom was not a great diet, maybe mom was antibiotics, maybe mom got the COVID vaccine, baby will inherit this abnormal microbiome and begin with immune dysregulation early. If mom breastfeeds and can manage to get her diet on track, it can re regulate because the baby's microbes through retrograde flow will tell mom what to produce, and mom can then produce stuff that the baby needs, goes back out to baby. It's this wonderful system. And mom also produces something called human milk oligosaccharides, HMOs, anywhere from 50 to 200. Those human milk oligosaccharides serve no purpose other than they're food for bifidobacteria. So mom makes food for the bifido. And then whatever bifido chews up and leaves behind, the other microbes can pick it up. It's a very complicated system. And if you think we know it all now, we don't. The microbiome literature is changing literally by the hour. So this is what we know now. Maybe next year when we meet, I'll be saying something different. We're constantly learning. But I just did a stool analysis for a 8-month-old, 7-month-old baby, only breastfed, vaginal birth, no vaccinations. Mom eats the cleanest diet you ever can imagine. And the baby was like 75% bifido. And I thought the stool. And I thought, holy moly, I haven't seen one of those in a long time because this mom has a child with type 1 diabetes, an older child. So this mom has seen what autoimmune disease, now linking to the last part of your question, Becca, and then she was good on the diet before, now she's great
Yeah.
because we're seeing a rising tide of autoimmune disease. And what's driving it is low vitamin D. You need a certain microbes in your gut to activate it, called Bacteroides fragilis, and glyphosate interferes with the activation of vitamin D to its active form. Not to mention, we're told by mainstream medicine to slather our kids with sunblock. And so they're not receiving sunlight, which converts vitamin D2 to vitamin D3, the active form in the skin, and the skin being the largest absorptive surface in children. So I hope, did I lay it out in a comprehensible, understandable way?
Yes, there's I mean, moms, it starts with us and what we're doing to our bodies during pregnancy and pre-pregnancy, obviously. And then the ability to breastfeed, which unfortunately not everyone does have. And Liz has talked ad nauseum, like she struggled with it with both children. I struggled. I wasn't never like a great producer. I barely made it to 6 months with my daughter. Yeah, but either way, what can you do after the fact? So like say we now have a 3-year-old, right? And we know that there is maybe non-optimal levels of bacteria, microbiome diversity. The gut is maybe an issue, or they're having, ADHD type behaviors, or they're having autoimmune or skin irritations, eczema, all of these things. Where would you begin with a child that presents with dysfunction?
Yeah, so if you can work with an integrative practitioner, that is ideal. And if you can't afford a functional medicine practitioner or a holistic chiropractor or a naturopathic doctor, there are many different individuals who can do this. Sometimes holistic nutritionists are more affordable. But let's say you don't have access to any of that, or you're a mom on a limited income, and you just can't swing that. So what do you do? The first steps is you must reduce the toxic load. We can't treat anything if you're still receiving the toxins and toxicants. It won't work. So you must reduce it. And the main ways you reduce the toxic load is through your food, your water, your air, your personal care products, your cleaning products, and medications and injections. It has to be sort of an internal and external milieu cleanup. And it takes time because this is not how we're trained to do things. So I know people. I just was at my friend's house, pediatrician and a nurse couple, raised 3 boys, 2 with significant health issues, adults, and they don't eat organic. And here in California, crunchy California, and I'm thinking, how is this possible? It blew my mind that I'm still saying this now for 25 years, you must eat organic. I don't know. I wish I had $1 for every time I've said you must eat organic. I'd be retired. Probably not, but I would think about it. So got to do that. Get the best water filter you can afford. So right now, only Florida and Utah pass bills to get the fluoride out of water. Fluoride is a thyrotoxic chemical. It displaces iodine from the thyroid. What are we doing? It causes fluorosis of children's bones. This is like the worst thing we can do. I think 75% of the US fluoridates their water. Here in my county, they fluoridate. So try and get the best water filter you can and get the fluoride out, not to mention the pesticides. Now, if you can't afford an air filter, especially if you live on a busy street or a city and there's a lot of air pollution and your kid has asthma or recurrent respiratory issues, there's a lot of particulate matter, which is really toxic for kids. What parents can do there is get a good HEPA filter like Air Doctor or Blue Air. I have no stock in these companies. Or do what I did is I have spider plants throughout my house. And as they grow babies, I put them in water, I restart them and replant the next one. I have about 10 spider plants around my house and right outside my office. So in the summer, I open the door and I don't have to worry about toxic air. So there are house plants that will clean your air, and that's a very beautiful, affordable way to get your air clean. And then moms, I do all the cleaning in my house. I'd like to say dads, not happening in my house. And even when my husband does clean, he does a terrible job. I don't know. 32 years, he just still can't clean a kitchen. He knows how to play golf, but can't clean a kitchen. Sorry, he's not here. I'm throwing him under the bus. So, okay, I use white vinegar and water. I occasionally throw baking soda in it. That's all I use. And I use a clean soap detergent that I buy little squares, not the box. I think I buy True Earth, it's called. So I made a conscious attempt to use less toxic cleaning products. And in terms of women, are the key drivers of using lots of toxic chemicals on their body, gals. Now I'm going to throw the women under the bus because women, I think, on the average, use 20 products a day. And I'd say, what are we doing? Like, ladies, you think all those products are clean? Show me the list. I bet they're not. So this is a shout out to our own behavior. I understand we want to look good. We want our hair to look nice. Absolutely. But we have to be very mindful about what we put on our face, our hair, our skin. So this is sort of number one. Number two is that you have to get those fermented foods in kids' diets. Before you start running and buying probiotics and everything else, try fermented foods, make cabbage at home, ferment it, and kids will often take 10 times of trying a new food before they accept it. Oh, it's a journey. And ferments have a very distinct taste. So you have to start with small amounts. And what I do now is because I don't do dairy, I ferment coconut milk with probiotics and inulin, and I have an Instapot. I don't like it because it's a toxic metal, but then I use glass jars in my Instapot to make this coconut yogurt, which is delicious. And then I'll add a little bit of fruit preserve to sweeten it for the kids. I don't need sweetener, but parents, sometimes kids need a little apricot preserve, or you can put a bit of maple syrup in there and make it a bit sweeter. I love coconut milk for children because the fats are easy to digest, medium chain triglycerides, and they're really good for the brain. So just to give you an idea of the thinking that we're doing to try and reshape our house. Now I keep saying moms, but this is a family thing. Okay, dads can learn to do this. Okay, they can fix stuff, they can get in the kitchen. If you've got the house where moms are in the kitchen and dads are doing all the garden projects or however you have it in your house, fine. But get the kids in the kitchen. I didn't want the kids in my kitchen when mine were little because I didn't want a dirty kitchen and I didn't want to clean it up. Oh my God, what a misstep that was. If I can do the rewind of a couple of decades, I would have my kids in the kitchen, getting it dirty and making food. That was a misstep. Number two is I have a garden, veggie garden. Why wasn't I having my kids plant? I don't know. I was working, I was busy. I didn't eat. It wasn't even in my radar that kids should be in the garden. Another misstep. But there's no retrospectoscope. This is not perfection. It's a journey, but we have to be spending more time not doing drive-through, but making and preparing our own food. That's where we went sideways. When in the 1960s, well, 50s, moms, we in the workforce, women went to the workforce in the 40s when the guys all went to the war. Guys came home, then women became 50s moms. Then women went back into the workforce in the 60s, and KFC, Kentucky Fried Chicken, was the first one to come in and say, hey, moms, don't worry about cooking. You're in the workforce now. We'll make dinner for you. And that's where it all began. And don't I understand it's convenient to do a drive-through takeout. Oh, I get it. But that is not, those foods are GMO, pesticide laden. Someone's got to cook. It doesn't have to be Alice Waters. We're not Chez Panisse. You can make very simple meals for your children that are delicious. And so I'm going to be doing a whole course on that coming up soon on how you prepare delicious meals for your children.
I love that. And one thing that we see in our practice, and I'd love to hear your thoughts on this as well, is that for picky eaters, a lot of times it's actually because they're deficient in a lot of vitamins and minerals. And so when we can start to correct those deficiencies, they open up their palates a little bit more and are willing to try other things. Would you agree with that?
200% because glyphosate, which is in all our kids' diet, binds toxic metals and it also binds organic metals. So it binds zinc, magnesium, copper, calcium, magnesium, manganese, et cetera, et cetera. And so kids are extremely deficient. If you ask your pediatrician to test for magnesium and zinc, which you need to run over 200 reactions in your brain, they'll run a plasma level. And the body does everything it can to maintain those plasma levels. So your pediatrician will say, oh, but see, it's normal. Nothing wrong with your kid's nutrition. You have to order a red blood cell magnesium and zinc, and those are frequently low. Why am I talking about magnesium and zinc? Ah, glad you asked. Zinc is what can cause that picky eating, a lack of zinc.
Mm.
And as you correct their nutritional deficiencies and give kids a really good multivitamin and mineral, some of that pickiness or even sensory defensiveness will improve. And so in my new book coming out, I have 25 ways to get your picky eater to eat for children who are not with neurodevelopmental disorders and those without.
I love that. Can you share a couple of them?
Yeah. So for children who are without neurodevelopmental challenges, they're okay. So what you have to do is make mealtime not a stress time. I often do songs and stories around foods. I sing songs like Pretty Pea Song and that kind of thing. I never do the bribe. If you eat your peas and spinach, you get dessert. Oh, no, no, no. And we say up, we say take one bite. We do one bite. If you don't like it, you can put it down. And you do that at least 10 times in a row. I also do, I was not above doing books even at mealtime. And I was a big fan, people might not like it because it's kind of bribery, of the star system. I'd say, I know eating those peas doesn't taste very good. If can you give it a try? If you give it a try, we get a gold star on a chart on the refrigerator. If you get 3 gold stars this weekend, we're going to go to that park you love. We're going to go to the library. Not a food reward. You get to spend time alone with mom, and we're going to watch a movie together. We're going to read whatever it is that your family loves to do. We're going to do a bike ride, just you and mom, and we're leaving the other kids home. You know, right? And that's how I actually got my son to read, was doing these star charts. I'm a big fan. Children love seeing those little stars, and they stamp themselves, and they could put gold stars on. So these are some of the things you can try. Now, for the child who is with autism, with neurosensory defensiveness, or a lot of the kids on the spectrum are very picky, it becomes more of a challenge. And many of those kids only eat 3 food groups, and I call it the white food diet. They'll eat white bread, French fries, and chicken nuggets. I've had so many patients like that. I thought, oh my God, and ketchup. That's their fruit group. And so with those kids, it's a lot challenging. And I have found the trick with those kids are cold smoothies or frozen ice pops. For some reason, some kids with sensory defensiveness will take cold pops. And so you can make a healthy smoothie, freeze it in a metal pop. Of course, sometimes all you can find is plastic, but okay,
Cold.
sometimes we just have to give in on certain things, you know, do the best you can. And you make frozen pops. If you use coconut milk, pineapple, and throw a little bit of vitamins and minerals in there until they get used to the taste, that is another way. And you give them the frozen pops. That has worked with a lot of my kids with picky eating. So there's a couple of ideas of things parents can try.
Yeah. I love
Can
that.
you talk through a little bit, going back to why a lot of children end up with these immunological disorders and deficiencies or overactive immune systems because of the schedule that we are subjected to and
Mhm,
told to follow, and
mm,
the levels of exposure that these kids are under in the first 7 to 12 months of life. And fortunately, my daughter was during COVID. And so after 2 months, I basically didn't take her back until she was 3 years old. She was never sick. She never had, she didn't have to deal with, hey, I need someone outside of myself looking at something in terms of an illness. Can you talk a little bit around why that constant stimulation of the immune system via shots
mhm,
and vaccines creates
mhm.
such a problem for an immune system in a child?
Yeah. I mean, I've heard people who are really well spoken on this, such as Dr. Suzanne Humphreys or Dr. Sherry Tenpenny, Dr. Paul Thomas, and so I've learned a lot reading a lot about it, why it is, and I took care of in my practice a lot of kids with autism and chronic health challenges that left mainstream medicine because their pediatricians say, well, if you're not going to vaccinate, you have to leave the practice. The reason why these parents opted out not to vaccinate is because it was the vaccine where after the vaccine, often the MMRV, measles, mumps, rubella, varicella, and now there is a 6-in-1. Don't even get me started. That they're pushing on parents. Often lost milestones after 15 months. Was sort of the straw that broke the camel's back. So when you have all these various foreign antigens in one for microbial proteins that this child has never seen before, you don't see infections like that in nature. Now, the 6-in-1, I think it's called Vexellus is the name. Vexellus is a 6-in-1 is that they get a massive immunologic response because they add aluminum. Aluminum is an immunologic adjuvant, which means it's to put in there to stimulate the immune response. So the kids get this massive response to these 4, 5, 6 foreign microproteins, and then which can literally cause something called cytokine storm. It really develops an immunologic storm. Now, this storm doesn't just stay in their blood, it's circulating across their whole body. And it crosses the blood brain barrier too, which then stimulates the immune cells in your brain. You have immune cells in your brain called microglial cells, and then those get activated. When you have activation of those microglial cells, that inflammatory response in your brain is very hard to quiet, and you can get neurologic disruption, abnormal immunologic responses. And if mom had this maternal immune activation during pregnancy, she passes this on to the fetus, and then the fetus and then baby has a higher risk of autism. So moms with the MIA, we call it maternal immunoactivation. Let's say she got shots during pregnancy, they pushed DTaP and COVID vaccine during pregnancy, then the baby got it through gestation activation. When those immunologic cells in the brain are activated, you can see behavioral changes, loss of milestones, regression of walking, talking, social interactions. That's what we see in autism, right? And it's very hard to quiet, not impossible. If the gut is leaky, the brain is leaky. What makes the gut leaky? All these toxicants that we've been talking about, particularly pesticides. It's even in formula. It's in if unless mom is eating 100% organic, it's in mom's breast milk. Um, Glyphosate's like a synthetic amino acid. It's small. N-phosphonylmethylglycine, super tiny, processed right from the breast milk right into the baby. So that also disrupts the microbiome. Glyphosate's an antibiotic, causes leaky gut, and all these things that cross the blood-brain barrier. Brain, gut leaky. It's the gut-brain microbiome access and constant communication. So we've now created this immunologic storm that's very hard to quiet that manifest as things like ADHD, autism, other neurodevelopmental disorders. You may have heard of sensory defensiveness, auditory processing disorders, kids who have super touchy skin where you can't put anything on them. Say, oh, take it off. It bothers me, mom. I've seen it all where their neurologic systems are just
Yeah.
activated. And what we do in all these kids is we heal the gut, heal the leaky gut, rebalance the microbiome, restore the nutrients, calm the inflammatory response, remove triggers, remove any infections that baby may have acquired from mom or the environment, get rid of the toxic metals, and babies do better, kids do better. And that is really the formula on how you reverse autism.
Yeah. Everything starts in the gut. It's ground zero, right? It's it's just eye-opening to me that this is not something that pediatricians are talking about or asking more questions about. And so, you and several others that have been, the trailblazers is helpful for parents who can listen to this. And just, if you're listening to this and you're thinking, I've never heard any of this before, obviously go to her website, other people that you can research out and just start asking questions. I think moms, we have this instinct to say, this doesn't sit right with me. I had that with my first son, and very similar to what you just mentioned, milestones started dropping, speech delay was there. He was getting ear infections. And our pediatrician told me he needed to have 6 ear infections before we would see an ENT. And I said, no, no, we've been to the emergency room twice. This is not like my child. There's no reason for this. And so we saw the ENT, got him tubes, and he's been fine since. But if not, my only other option would have been going back and doing the conventional treatments, antibiotics, and things like that. And so I would love to have you touch on, if you're willing, children like that, who, you're seeing these reoccurring infections. Knowing now what I know, then I wouldn't have done the things that I did. But I was a first time mom. I didn't know. He's got 105 fever. Okay, whatever you tell me to do, we're going to do it, right? That, and then reoccurring strep. I was just chatting with one of my clients. Her son is 7 that I'm working with, and we've done a lot of identification of things going on with his gut microbiome and various things, these deficiencies, and he's improving, but he keeps getting reoccurring strep. And I asked her, has he ever been checked for EBV? And so he has not, but I think that's a route that I've recommended she explore. I'd love to know, what do you say or, do in those situations where these kids are just getting these infections like back to
Mhm.
back to back?
Yeah. So a couple points. First of all, we don't shame and blame, right? So we all did things that we just didn't know. And here we have the mainstream medical system, pediatricians who we love and care about, who really do love our children. It's not to say these pediatricians are bad, but they're trained in a model and they're not thinking outside that very limited narrative. And then you have parents who say, Harvard, Mayo Clinic, Johns Hopkins says this, and you're saying the opposite, but I should believe you. So it's a real stretch for parents, right? Because they are inundated with one narrative. And to fight against the system, believe me, this is not easy. It is really difficult when everyone is telling you to do one thing and your gut is telling you to do something else. So bravo parents. And so oftentimes dads will go with the mainstream. Dads, wake the heck up. You've got to support moms. If you don't learn anything by now, is that your wife, your partner, whatever, knows your child, because mom has fetal cells in her and that baby has mom cells in them. So mom knows when the baby's getting sick before the baby does. So just trust that this relationship exists. Now, if you have somebody with recurrent ear infections, let's start there. They've got a dairy sensitivity to proven otherwise. You've got to do an elimination diet. You've got to get them off dairy, and I just take gluten off at the same time. And often that will resolve it with a homeopathic remedy. The remedy is often silica 30C. So, and I've got that in the book coming out. So I'm going to give parents how-tos to how to do this. If the dairy is an inflammatory protein, parents don't know that, right? We've been listening to Got Milk forever. I have on my website a series. I just wrote Article 7. It's called the Got Real Milk series. I have all my stuff on infant formula. And this week will be going up my last 7th article in the series. I hope this is my last one on synthetic milks, board cow. Don't even get me started. So parents are also being inundated by media. This is fine. This is natural. This is better living through chemistry. No, no, no. It's the food techie business making lots of money off patents, off of genetically engineered patents. So that's what it is. Let's just call it what it is. Now let's get to this recurrent strep. I don't like to see recurrent strep because it can be linked to PANS. That's a pediatric acute neuropsychiatric disease syndrome. I think that's the acronym for PANDAS. And PANS is the pediatric acute neurologic syndrome, often seen from Lyme. PANDAS is often from strep. You can have many organisms that can cause an autoimmune basal ganglia encephalitis in your child from these organisms that look a lot like us. Strep looks like us. It was probably we probably were derived from a similar microbe. We have a lot of what we call molecular mimicry to strep. If someone's got recurrent strep a kid, you've got to find the source where it's hiding in their body or who in the family is the carrier. It may even be the family dog. And the most common places where it is, it's in the poop, it's in the rectum, it's in the throat, in the tonsils. I have a kid I'm working on right now, and mom actually took her kid to Germany to get his strep that was embedded in his tonsils because she didn't want a tonsillectomy. Frozen cryotherapy for the tonsils. It worked temporarily and then he relapsed. I have in the past, not for many years, sent kids for tonsillectomies where we could not get rid of the strep and we tried everything. And so the other thing is to get a stool microbiome test. I use GI Maps, Doctors Data, Mosaic Lab, US Biotech. There are Vibrant Labs. There are a bunch of different labs that do it. You got Genova. You got to get the stool map and see if there's strep in there, and you'll see strep. It's often in the poop, and sometimes I'll use herbal antibiotics to get rid of it.
Okay.
So I try and get rid of it, and while you're doing that, you're bolstering the microbes, the beneficial microbes, because they'll often keep the pathogenic microbes in check. So I'm doing a fermented rich diet as well as probiotics. I give a lot of kids probiotics. I'm one of those practitioners who does believe in probiotics, that they work. Some people naysay against them. It depends on the brand and where you're sourcing your probiotics from, but there are some good brands.
Do
What
you
do you love
have
most?
Yeah, do you have a favorite children's for, like, kids in the ages of 3 or 4 to, 8 or
Yeah.
9?
Yeah, there's 2 brands that I tend to like, and again, I don't have stock. One is called Smidge Probiotics,
Mhm.
I like them. I also like, Theralac, Theralac. The guy who owns that company knows everything about the microbiome. His name is Jeffrey, I forgot his last name. And let's see, what else do I like? Sometimes I use BioK or BioCult, and I also like Microbiome Labs for spore biotics and Biocidin's probiotic. Now, here is a disclosure. I have spoken for Biocidin, but I do like their probiotic. It's called Proflora because it has spores in it as well as some other gentle herbs, and I like that one. I do mix alternating spores, and those are organisms found in soil with beneficial microbes. So I like the blend.
Yeah.
I'll often alternate them.
Yeah.
So when it comes to kind of foundational habits, if a mother, a parent is listening, and 3 biggest things I can make as an impact on my child. Obviously, it sounds like remove the toxic exposures, the foods, eating organic, potentially probiotic support. What else would you say?
I would say families can do the top thing is would remove, as you said, Becca. Two would be to if they have any type of immunologic, neurologic issue, and immunologic can be asthma, allergies, eczema, recurrent infections, maybe mild autism, ADHD, remove gluten and dairy from their diet. And 3 would be give a quality multivitamin with mineral and probiotic if you cannot get fermented foods in that kid. Sometimes you cannot. It is a battle. And I
Yeah.
don't want to see everyday battlegrounds at the dinner table. I mean, what are we doing? You know, so in those kids, just give the probiotic. And please, not those gummy probiotics that have so much sugar in them. The Theralac is a powder and the Smidge is also powder. And you can put it in smoothies or drinks for the kids, herbal teas, and it doesn't really have any taste.
Yeah,
Doesn't. They mix really well.
they do.
Yeah.
Yeah, I do like grass-fed organic whole milk yogurts for my kids, and they tolerate those. So I mix it up with that, and I'll put sometimes like little chia seeds, or I'll do, a healthy granola or something like that for them to hide. More fruit on top, things like that.
And fruit on top, and then I will resort to preserves, fruit preserves, apricot, raspberry. I'll throw a little teaspoon of that in there if I must. Oh, I do, just a spoonful of the sugar helps the medicine go down. Listen, kids don't need extra sugar, but there are desperate situations where you need to get certain things in.
Yeah.
And I have resorted to it. I'm not proud, but sometimes we have to do what we have to do until they're better, and then you can pull things off or substitute. My other best friend is frozen fruits
Mhm.
that you can put into smoothies. Like you can go to Costco or someplace and they sell the organic froze fruits like
Mhm.
mango, all these delicious fruits. And you can throw a couple pieces in there, it sweetens it up, and they get some nutrients.
One of
Yeah.
the worst things was my son learned how to read, and now he can read if there's vegetables in things. And I'm like, you haven't even tried this applesauce. Before you read that there's spinach in it, you were fine. It's-
Well, I used to steam the spinach and then make it into a cheese sauce for my own kids' pasta. That
Mhm.
was the way I got them to eat broccoli, and that now they both eat tons of veggies. That worked. Cheese hides a lot of flavors if the kid is not dairy intolerant, and if they are, maybe you can go to a goat cheese. And if that doesn't work, perhaps you can go. Miyoko makes a really nice vegan cheese. It is processed, but there are alternatives. And if you must give tofu, and I like organic tofu, fermented is my favorite tempeh. You can use that as well, but I kind of go off topic, but there are alternatives. You have to go seek them out.
yeah. This has been amazing. And you mentioned you have a book coming out. So would love for you to tell people the name so that they can keep an eye out for it. I know you've
Yeah.
had some bumps in the road of getting it out to the public, but let our listeners know where they can find you, the book that's coming, all of the things.
Well, thank you. After I wrote the first book, What's Making Our Children Sick, I said, I'll never write another book again. That was so painful. It was like dental work. I said, oh, I'm so done with this. O Okay, so now the second book, because I just decided before I become compost and they put me out with my chickens, that I needed to download my brain because I've accumulated a lot of info, taking care of people over the decades that I wanted to download in a how-to book. So I made a response. It's called Making Our Children Well. It'll hopefully be out by September, editing it literally on the other screen as we speak. And this is empowering parents with nutrition and homeopathy. I love homeopathy. I love nutrition. That's why I've joined up with Salad Masters because I want to get information out to families on what they can do. Practical, solutions based. This is not an academic book. I have sections for notes because when parents see that something works for their children, whether it's a supplement, a food, a homeopathic remedy, write it down. Like, oh, this worked for little Susie. Why? Because you don't remember. You think you're going to remember, but you don't. So I have places in the book where you can write it. And I like writing and not recording it on your iPhone because when you say, write, and read something, it stores it in your memory better versus just downloading on your phone. I get it, millennial parents. I understand. I have two millennial children. I get it. But for this is old school. I ask parents to buy the book. I'm making it like a manual and they can use it as a working book to look things up. I have a section in there, and I'm going to put up freebies on my website, Stages for Ages. The main issues, infancy, childhood, and teens, and the main remedies, homeopathics, that you choose. And I have a section preceding that on what is homeopathy, why is homeopathy, and why it's so amazing.
Love that.
I love that. Thank you again so much for coming on today and just the work that you're doing. Like you said, it is not easy by any means. And I'm sure that you have a lot of people that, try to work against you. But I think that it's important to speak the truth and people, they'll find out someday. Maybe not right now, but I think more and more people are realizing this. The last question that I just had quickly for you, if you don't mind giving a thought here. You mentioned pesticides, herbicides, glyphosate, atrazine. We're seeing them all the time. I'm seeing them on multiple, reports coming back and testing for individuals. Would you recommend the average person, taking something like a Glypho X from Supreme Nutrition or different herbs or homeopathy remedies just to support detoxifying those things because they know, let's say the person travels a lot, they don't have access to, or maybe they can't afford all organic and they can do their best to wash fruits and vegetables. But
Mhm.
thoughts on a binder like that, just to
Yes,
kind of help?
100%. So I think in this toxic world that we live in, and I agree, people travel a lot. 100%, they should be on something.
Okay.
So there are different ways you can clear. You can do binders. You can do the Glyphox. You can do GI detox. You can do oh my gosh, so many bentonite clay. You could do charcoal
Okay.
takasumi. There's so many things you can do. Yes. Do you need binders all the time? No, because binders bind everything.
Right.
So you want to take your binders away from any supplements or medications that you might be taking, so they will bind it up. One. Two are detox baths. The skin is a great absorptive organ, and people can detox in a bath. Kids, I say twice a week. Adults can do it once a week because adults are not jumping in the tub. It takes time. But if you use a cocktail of Epsom salt, sea salt, occasionally throw some boron or borax in there, as well as baking soda. You can get a nice detox and then rinse. Or with sometimes with babies, I put onions on their feet with little socks, and you can pull toxins out through the feet. So for sure, sweating, infrared saunas. I'm a big fan of saunas. But yes, there are some cultures in some countries where they sauna every day. In Sweden, I think they do saunas like a regular part of their health ritual. Japan, some places also. I like infrared, but if you just have a sauna, sweat, exercise. If you're on the road a lot, you're a traveling adult, you need to work out. If you're in a hotel, go to the hotel gym or run around the hotel, do what you have to do because exercise is a great way to detox. And
Mobilize.
eat as best as you can while you're traveling. There's going to be missteps, but if you're overall healthy, you should survive. Apple cider vinegar is your friend. Lemon juice in your water is your friend. A little bit of bicarbonate, sodium bicarbonate in your water. I throw a pinch in mine, and occasionally I throw a pinch of borax in there for my joints. In my water, we've been led to believe that boron, it's actually boron, is toxic. It's not. You don't drink a whole cup of it. Hold on, people. Modicum of common sense. I'm talking a pinch.
Yeah.
Pinch. So, yes, I'd rather not do binders, but when people are in that situation, 100%. But if I am doing a cleansing protocol, I will give them a binder as we're working together because as you release various toxic materials, some people need assistance mopping them up as you excrete them. Poop, pee, sweat, breathe, brain, lymphatics.
Yeah. I love that. Perfect. Thank you so much because we have talked about that many times before and always
Yeah.
curious to hear other individuals and just very applicable things, to kind of help lessen the load on the body and live in the world that we live in in a healthier way.
100%.
Awesome. Thank you so much. And we'll be in touch soon. We'll make sure that we get all of your links in the show notes as well so people can go follow you, find all of the valuable information. She has an amazing website, lots of goodies there for you to dive into. And thank you so much again for your time.